Assalamu alaikum. My name is Laiba Imran, student of BS Clinical Psychology from University of Sialkot, and the topic on which I am going to give lecture today is binge eating disorder. These are the table of contents about the disease, symptom, causes, risk factors, and treatment. What is binge eating disorder? Binge eating disorder is a serious eating disorder. People with this disorder eat a large quantity of food in a short time frame called a binge eating episode. These episodes occur at least once a week for several months. People who have binge eating disorder may eat so much that they feel sick afterwards, or they eat large amount of food even though they don't feel hungry. A person with the binge eating disorder begin with a typical meal but then lose control and eat much more than they anticipated. Frequently eat alone or in secret, feeling depressed, disgusted, ashamed, guilty, or upset about their eating. Frequently dieting, possibly without weight loss. Following are the causes. Genetic study shows that the disorder is inherited if anyone in the family or first degree relative has a history or being diagnosed with the eating disorder. Gender. Binge eating disorder is most common in women as compared to men. Changes in the brain. Study also shows that people with binge eating disorder may have changes in brain structure or chemical that result in response to food and less self-control. Negative effect is also commonly associated with binge eating disorder. People may use binge eating as a way to make themselves feel better. Relationship with friends, family, and other people and social issues can also result in the binge eating disorder diagnosis. Risk factors. Binge eating disorder is associated with several significant physical, emotional, and social health risks, such as physical overweight, lack of energy, emotional being worried about body image and weight, social what people are going to say and how will they judge you. Up to 50% of people with binge eating disorder has obesity. Obesity is excessive fat in the body that can increase risk of heart diseases, stroke, type 2 diabetes, and cancer. Psychiatric disorders are also linked with binge eating disorders such as depression, bipolar disorder, anxiety, and substance use disorder. It can also cause problems at workplace, with your personal life and daily life routine and social situations or gathering, high cholesterol and blood pressure. In women, the condition is associated with risk of fertility problems, pregnancy complications, and development of PCOS. Following are a few treatments to cure binge eating disorder. Cognitive behavioral therapy. It focuses on analyzing the relationship between negative thoughts, feelings, and behavior related to eating, body shape, and weight. Once the cause of negative emotions and patterns have been identified, strategies can be developed to help people change them. Intrapersonal psychotherapy. The goal of this therapy is to identify the specific problem linked to the negative eating behavior, acknowledge it, and then make constructive changes. Dialectic behavior therapy views binge eating disorder as an emotional reaction to negative experience that people has no other way to cope with. It teaches people to regulate their emotional responses so they can cope with negative situations in daily life without binging. Weight loss therapy aims to help people lose weight, which may reduce binge eating behavior by improving self-esteem and body image. And lastly, medication can also be used to treat binge eating disorder. That's all from my side. Thank you.